Are you having all the signs and symptoms of pregnancy and you keep on doing the pregnancy test with the urine, with the blood, and it keeps on being negative? What is happening? So this video is for you today. Today I'm going to be answering a question which was sent by Favor Innocent. Good day, doctor. Please, I am very confused about what is going on with my body. My last period was on the 17th of August. I still haven't gotten my period since then, but have been having negative results. I just came back from the lab where I went to do the first blood test and it turned out to still be negative, but I've been having most of the signs of pregnancy. Is it still possible that I am pregnant even with the negative test? Is it also possible for a woman to never get a positive pregnancy test throughout her pregnancy stages? Please kindly reply. Thank you, doctor. So today I'm going to be answering this question, whether it is possible to have a negative pregnancy test and the woman is actually pregnant, but throughout her pregnancy she has a negative test. So don't miss out on this episode. Now, what we should know about pregnancy tests is that I have made a video explaining in details what are the various causes of having a negative test but you are still pregnant, or you are having all the signs and symptoms of pregnancy but the pregnancy test is negative. What could be the error? I'm not going to go into details with this. So after this, if you want to watch that video, you can go back. So this is Talk Pregnancy with Dr. Nuella, where we tell you all about pregnancy and women related health issues. To those who have subscribed, thank you very much. Those who have not subscribed, don't forget to click on the subscription button and the notification button. So let's dive right in. If you have to do the pregnancy test every day throughout your pregnancy, at one point the test must be positive. So it is not possible to have a negative pregnancy test throughout your pregnancy. If you have taken it accurately, you should have a positive test. But in which case can we have it negative even if you've taken it accurately? These test strips are always put at extremes. These tests detect the level of the human chorionic gonadotropin hormone, which is produced during pregnancy, and as the pregnancy advances it tends to increase. Now, if you take the pregnancy test accurately but very early, it means it has not yet reached the level where this human chorionic gonadotropin hormone can be detected. If you take it too far during pregnancy, when the level of the human chorionic gonadotropin hormone is too high, so it has passed to that extreme, then it can show you negative. So these are the only times when, and these things, they just vary. It depends. So if in between you take it within that period, definitely you should see it positive. And now, why should you be going through that stress? One thing I want to advise to women out there is that with the pregnancy test, there are various things which can cause it to be negative while you are pregnant. Concerning the signs and symptoms of pregnancy, what all women out there should know is that with pregnancy, there's what we call the presumptive diagnosis. That's you're just speculating. The probable diagnosis of pregnancy and the positive diagnosis of pregnancy. So with the probable diagnosis of pregnancy, probable signs and symptoms, that's speculations. When we start having absence of menses, vomiting, nausea, your fatigue, you feel your breast painful, you feel it increasing in size, you feel your abdomen getting distended. So those are just presumptive signs. You are just speculating that you could be pregnant. Now, probable diagnosis is if you have a positive pregnancy test, because there are some cases where you can have a positive pregnancy test and it is not even pregnancy or something else. So if you have a positive pregnancy test that is probably showing that you are probably pregnant. If you start having, maybe you start feeling fetal kicks depending on the age of the pregnancy, those are probabilities. Also have like few contractions, lower abdominal pains, on and on contractions. So with this, the probability that you are pregnant is very high. But now the positive diagnosis of pregnancy is when a baby is actually seen in the womb of the woman. We should know that with all these presumptive probable diagnosis, if at the end you do an ultrasound scan and no baby is seen, then you are not even pregnant. It is important that before a woman confirms that she is pregnant, it means you have missed your period, you're having your signs and symptoms of pregnancy, you've done the pregnancy test and it is positive, and you do an ultrasound and you see the baby there. So in this case, for the question we are answering, where she even did a blood test and it was still negative, why not do an ultrasound scan to check whether there is actually a baby or not? Once there is no baby, there are other causes of absent menses. So these signs and symptoms can be coming due to different things, which we are going to talk about it. So it's important that women should know that once you have these absent menses, the first thing you think of pregnancy. It's very, very okay to think of pregnancy. But once you do the pregnancy test, it is negative. Check whether you have made any error. You check the date of the strip, you check whether you've put the right quantity of the urine, and you check whether you have put it at the maximum level or at the level that is required with the test strip. If you're not able, if you've seen that you've done all this correctly and it is still negative, seek an expert opinion. Go to the hospital. They're going to check also they do the blood test to see if it's also negative or positive. If it's negative and you still have that feeling in you that you're pregnant, why not request for an ultrasound scan? If it's negative, then you should see now that you are not pregnant. You with all this, and you don't go now through the stress and saying 1 month, 2 months, I can't see my menses, what is happening, and I have all the signs and symptoms of pregnancy. No, you are not pregnant. There are other things which can cause that kind of signs and symptoms, which I think if you go to the hospital, proper checkup can be done in order to find out what the causes are. From this, we can see that for a woman to confirm that she's pregnant, it means we have seen a baby inside her uterus. Do you know that some women actually go to the hospital for other complaints, and during an ultrasound scan, a baby is seen, they say, madam, you are pregnant, and maybe she did not know. In that case, do you go back to start doing the pregnancy test? No, you just confirm that she is pregnant and you start following up the pregnancy. So that is just positive. You see that they don't go back to start doing all the other ones. But if you have the assumption, they must do the probable test and then they do the positive test. I know it is a very frustrating situation where you have all the signs and symptoms of pregnancies, especially with women who really want to get pregnant, who have been trying for a number of years. Once they miss their period, the first thing they think about is a pregnancy, and once it's negative, they keep on trying to make sure to see whether there is no error anywhere. But there are other causes where you miss your menses, but at the end you're not pregnant. So after this video, I'm going to be making another video on what are the most common causes of having an absent menses in particular and a negative pregnancy test. After this, if you want to keep on watching, you can click on the next video and watch this video to see what are the most common causes and see where maybe you fall. Now, it's always important, once you have this, once you've done the test and it's negative and your menses stays 1 month, 2 months and it's not coming, try to think that there is a problem somewhere. So seek a medical opinion. Go to the hospital. Let a proper checkup be done. And from there, you might see that the cause might just be identified, and at the end, you get pregnant. Thank you very much for listening. And if you want to have a private consultation with me, you can click on the link on the description box and book for a consultation with us. Thank you very much. God bless you, and I love you all.